Somewhere between your bedroom and kitchen, your brain just experienced a silent stroke precursor and you didn't even notice. It happens to 8 out of 10 seniors every single morning. And tonight, I'll show you exactly how to protect your brain starting tomorrow. I'm Dr. James Carter, neurologist and stroke specialist. And what I'm about to share will shock you. You see, the morning habits most people believe are perfectly normal, even healthy, may quietly be increasing the risk of a life-altering stroke. The truth is, while you're brushing your teeth or sipping that first cup of coffee, subtle changes are already happening inside your body. Your blood pressure is rising fast, your arteries are tightening, and your brain is struggling to receive the oxygen it needs to function properly. This isn't just a theoretical concern. These are the very patterns I've seen in hundreds of patients, and what I'm going to share with you has completely transformed the way they start their day, and in many cases, has prevented life-threatening emergencies. If you're over 60 and want to hold on to your independence, your clarity of mind, and your ability to live life on your own terms, hit that subscribe button to Inspired Living right now. Today, we're diving into 7 common morning habits that silently raise stroke risk in adults over 60. But more importantly, I'll walk you through a simple, science-backed morning routine that could reduce that risk by up to 50%. But before we talk about the steps you can take, I want to tell you a true story, one that changed the way I think about mornings forever. 3 weeks ago, Margaret walked into my ER. It was 8:30 on a Tuesday morning. She's 67 years old, a retired teacher, active, sharp, doing yoga 3 times a week. The kind of person you'd assume was doing everything right. That morning, Margaret collapsed in her kitchen while making breakfast. Her husband found her on the floor, confused, slurring her speech, and unable to move her right arm. But by the time the ambulance arrived, most of her symptoms had disappeared. I knew immediately what had happened. She'd had what we call a transient ischemic attack, a TIA, often called a mini-stroke. It's a red flag. A whisper from the brain that a major stroke could be on its way. Now here's what really shocked me. When I asked Margaret to walk me through her exact morning routine, she listed 7 habits, common things millions of people do every day, and none of them seemed dangerous on the surface. But once we addressed those habits, something amazing happened. Margaret hasn't had a single neurological episode in over 3 months. Let me explain why this matters so much. Most people don't realize this, but the first hour after waking up is the most dangerous time of the day for your brain. According to the American Heart Association, most strokes occur between 6 a.m. and 10 a.m., with the greatest risk concentrated in the first 2 hours after waking. Here's why. When you sleep, your body slows everything down: heart rate, blood pressure, even the thickness of your blood. As you wake up, your system suddenly shifts gears. It's like a cold engine being pushed to full speed without a warm-up. And if you're over 60, your blood vessels aren't as flexible as they used to be. This morning surge can create a perfect storm for a stroke. Now, let's talk about those 7 habits, and how they disrupt your brain's blood supply during that sensitive time. The first habit is jumping out of bed the moment you wake up. Margaret was proud of being an early riser. Her alarm rang, and within seconds, her feet were on the floor. But here's the danger: going from lying down to standing abruptly after 7 to 8 hours of sleep can drop your blood pressure by 20 millimeters of mercury or more. That sudden drop is called orthostatic hypotension. What happens next? Your brain doesn't get enough oxygen. You might feel dizzy, experience tunnel vision, or your knees might feel weak. This moment isn't just annoying, it's your brain's alarm bell, telling you it's struggling to adjust. So, what's the fix? I call it the 90-second rule: 10 seconds of deep breaths to center yourself, 20 seconds of flexing your ankles and hands while still lying down, 20 seconds of slowly sitting up and letting your circulation catch up, and 40 seconds sitting with your feet on the floor before standing. This tiny adjustment can make a massive difference. Margaret said this one habit alone eliminated the dizziness she'd felt for months, a symptom she once blamed on getting older. If you've ever felt dizzy when you stand up in the morning, type DIZZY in the comments. You're not alone. And it's not in your head. The second habit is skipping water and heading straight for coffee. For many, the smell of coffee is the only way to start the day. That was Margaret's ritual too. Coffee first. Water? Maybe later. But here's the problem: after 7 to 8 hours of sleep, your body is slightly dehydrated. Even 1% dehydration makes your blood thicker and circulation slower. Now add coffee, a diuretic that constricts blood vessels, and you've got a risky combination. David, a 71-year-old patient of mine, came in complaining of a racing heart every morning after his first cup of coffee. When we checked, his blood was so viscous in the mornings that his heart was working twice as hard just to pump it through. The solution? Drink 240 milliliters of room temperature water before any caffeine. Bonus tip: add a 1/4 teaspoon of lemon juice or a pinch of sea salt to improve absorption. Within a week, David's morning palpitations disappeared. The third habit is choosing healthy breakfast foods that are secretly loaded with sodium. Margaret believed she was making smart choices. Her morning meal usually included instant oatmeal and a slice of whole grain toast, what many consider a heart-friendly breakfast. But here's the hidden danger: these health foods often contain 400 to 600 milligrams of sodium before you've even finished your first cup of coffee. Take instant oats, protein breads, deli turkey, and store-bought bran muffins. Stack a few of these together, and suddenly you've consumed more sodium than your brain's blood vessels can comfortably handle. Sarah, a 73-year-old retired librarian, used to see her blood pressure spike to 140/90 within 30 minutes of breakfast. When we switched her from flavored instant oats to plain rolled oats with berries, her pressure dropped by 20 points in a week. Here's your goal: keep your sodium intake below 300 milligrams before 9 a.m. Build your plate using the 2-to-1 ratio, 2/3 vegetables or fruits, 1/3 complex carbs and protein. This one change can reduce morning blood vessel stiffness and improve overall circulation to the brain. The fourth habit is drinking black coffee on an empty stomach. Many older adults drink 2 or more cups of black coffee before eating anything, thinking it gives them the energy to tackle the day. But what it actually does is trigger an adrenaline surge of up to 60%. That surge constricts your arteries, raises your pulse, and sends mixed signals to your brain's delicate blood supply network. Take Thomas, age 69, for example. He came to the ER 3 times in 1 year, convinced he was having heart attacks. What he was actually experiencing: coffee-induced acid reflux and adrenaline spikes, all on an empty stomach. The fix isn't to give up coffee. It's to eat something first. Have a small, buffer bite, half a banana, a handful of nuts, or even 1 boiled egg. Then drink your coffee. Also, limit it to 1 mug, about 150 milligrams of caffeine, and wait at least 30 minutes before refilling your cup. It's about working with your body, not against it. The fifth habit is ignoring minor morning symptoms like dizziness, slurred words, or numb fingers. Margaret admitted that for months, she had moments where her words felt slow to form, or her fingers tingled when she woke up. She thought it was just grogginess, a normal part of aging. But here's what she didn't realize: these are warning signs. What she described were transient ischemic attacks, TIAs, short-lived stroke-like episodes that often happen 12 to 24 hours before a major stroke. These symptoms might vanish in minutes, but that doesn't mean they're harmless. Anytime you notice slurred speech, one-sided weakness or numbness, facial drooping, or loss of balance, it's time to act fast. Remember the FAST acronym: face drooping, arm weakness, speech difficulties, and time to call emergency services. Even if the symptoms disappear, log the time, date, and what happened. Contact your doctor the same day. Margaret's speech blips were not just grogginess. They were her brain waving a red flag, and if we hadn't listened, a major stroke could have followed. The sixth habit is taking all your morning medications at once, sometimes with coffee. This is one of the most overlooked dangers in the morning routines of older adults. Margaret was taking her blood pressure medication, thyroid pill, and low-dose aspirin all together, washed down with her morning coffee. She had no idea this was a recipe for harmful interactions. Caffeine can interfere with the absorption of several medications. And when combined with blood pressure pills, it can cause your pressure to swing unpredictably, sometimes too high, sometimes dangerously low. Green tea, for instance, when taken alongside beta blockers, can amplify the effects and lead to blood pressure drops that leave you dizzy or faint. I remember Ruth, 75 years old, who was struggling with lightheadedness every morning. When we investigated, her blood pressure was dipping below 100/60 an hour after taking her pills with coffee. Here's what to do instead: use a pill organizer with labeled compartments for morning, afternoon, and night. Read every label carefully. Some medications must be taken with food, others on an empty stomach, and some must avoid caffeine altogether. Space medications that might interact at least 30 minutes apart. If you're unsure, ask your doctor or pharmacist about the safest timing for each medication. Remember, medications are powerful tools to protect your health, but only if taken correctly. The seventh habit is staying in bed scrolling your phone while ignoring a full bladder. This may sound harmless. Margaret confessed that she often checked emails or social media first thing in the morning, even if she needed to use the restroom. But here's what's happening physiologically: when you delay urination, your body enters a stress state. The full bladder activates the sympathetic nervous system, which can lead to pounding heartbeats, blood pressure surges, and vasoconstriction, all while your brain is still trying to adjust to being awake. Frank, 68, experienced this firsthand. Every morning, he noticed his heart would start thumping suddenly as he got out of bed. At first, he thought it was anxiety. But when we adjusted his routine to include a trip to the bathroom within 5 minutes of waking, his symptoms vanished. If you wake up more than twice at night to urinate, consider cutting off fluids at least 2 hours before bed, talking to your doctor about the timing of any diuretics, and discussing prostate health, especially for men over 60. Even small changes like these can prevent massive spikes in stress hormones, and give your brain a smoother, safer morning transition. Now let's do a quick self-check. Here are 5 warning signs that your current morning routine might be putting your brain at risk. Count how many of these apply to you. Do you experience a head rush or tunnel vision when you first stand up? Does your heart race or flutter after your first sip of coffee? Is your blood pressure over 140/90 within 30 minutes of breakfast? Have you ever had speech glitches, a weak grip, or numbness that resolved in under 10 minutes? Do you notice a sudden pounding heartbeat when you finally get out of bed? Take a moment to count. Then comment your number below. Even if only 2 of these apply, it may be time to seriously rethink your routine. But here's the good news: stroke risk isn't written in stone. And every small change you make today can profoundly shape your tomorrow. Margaret, the same woman who collapsed in her kitchen that Tuesday, came back 6 months later for a routine checkup. And what she said gave me chills. "Doctor," she said, "for the first time in years, I feel like my brain is actually ready for the day. The fog is gone. The dizziness is gone. I feel more clear and alive than I have in decades. This is what gives me hope." Your brain has an incredible ability to recover and protect itself, if we give it the right support. So, what exactly did Margaret change to feel this way? It's what I now call the stroke-safe morning routine, and I recommend it to every patient over 60 who wants to protect their brain, preserve their independence, and reclaim energy in the morning. Let's go through it step by step. Step 1. Prepare the night before. Your brain in the morning is foggy, it's not the best decision maker. So, set up your morning environment ahead of time. Place a glass of water on your nightstand. Keep your pill organizer in plain sight. Lay out your low-sodium breakfast items on the counter. Think plain oats, berries, whole fruits, and healthy fats like avocado. When the guesswork is gone, healthy choices become automatic. Step 2. Follow the 90-second wake-up protocol. Just like we mentioned earlier, deep breaths for 10 seconds, flex your feet and hands for 20 seconds, slowly sit up for 20 seconds, then sit with your feet on the floor for 40 seconds. This routine gives your cardiovascular system time to adapt. It lowers the chance of dizziness, sudden drops in pressure, and mental fog. Step 3. Hydrate, then eat, then caffeinate, in that order. Think of it as a morning triangle: water first, 240 milliliters of room temperature water, food second, like half a banana, a boiled egg, or 5 almonds, coffee third, only after your body is ready. This sequence supports smoother blood flow, steadier energy, and reduces the risk of heart palpitations or adrenaline spikes. Step 4. Log your blood pressure and symptoms for 1 week. Don't just trust how you feel, track the patterns. Take your blood pressure within 30 minutes of waking. Write down any dizziness, speech glitches, or numbness. After 1 week, look at the trends. This can give you, and your doctor, a powerful picture of how your morning habits are affecting your brain. Step 5. Share this information with someone you trust. Strokes are sneaky. Symptoms can vanish in minutes. And sometimes, the people around us see red flags before we do. Whether it's your spouse, a neighbor, or your adult children, talk to them about what signs to look for and how to respond quickly. You could be saving not just your own life, but theirs, too. Now, here's what I want you to do. Pause right now and think, which of these 7 habits do you need to change? Was it jumping out of bed too fast, coffee before water, ignoring mild dizziness? Pick just one habit to improve tomorrow. Then type its number in the comments below and tag a friend who needs to see this, too. You'll be amazed by how one simple commitment can ripple into sharper thinking, better balance, and a stronger sense of control. Remember, stroke prevention isn't about perfection. It's about understanding how small, daily decisions add up, especially in the first hour after waking. Protect your morning, and you protect your brain. This video is meant for educational purposes only and does not replace medical advice. Please talk to your healthcare provider before changing your medications or routine, especially if you experience symptoms like dizziness, speech trouble, or numbness. And finally, if this message resonated with you, leave a comment below. Have you ever felt a head rush when standing up? Do you skip water and go straight for coffee? What's the one morning habit you'll change starting tomorrow? Let's talk. Let's connect. Let's protect each other. Because when we support our minds and bodies with care and knowledge, aging becomes not just safer, but wiser, calmer, and more empowered.